So as far as eating the meat from chickens grown either with or without antibiotics, there should be no difference to public health. Well, we actually never used disease prevention antibiotics just for the fun of it. We used them because they work very well and prevent disease, which is what you want to do. Unfortunately, we can't raise each chicken in a 10 by 10 foot room, so we have to put them rather in close confinement, and by doing that you have the opportunity for disease to spread rather rapidly in the case of a disease situation. Preventive antibiotics prevent that from happening. We use those for many years. They also, by preventing disease, also increase the growth rate and the feed efficiency of those birds, and actually mistakenly became labeled as growth promotants when in actuality they were disease prevention antibiotics. So once you get a disease in a closely confined group of animals or people or anything else, it's much more difficult to control and to stop that than to prevent it. So once you get the disease in a group of broilers or chickens, then if you have no antibiotics that you can use for therapeutic purposes to treat those birds, actually the infected birds just have to die out, and the disease has to become self-limiting, which in my mind goes against the veterinarian's oath of protecting against suffering in animals. Well, the USDA, actually the FDA regulates feed additive antibiotics by placing a withdrawal time on any antibiotic that's used in a food animal feed. The withdrawal time is based upon extensive research showing how long it takes for that animal to eliminate that product from the body to the point that it's zero or negligible residue. To say zero residue with the kind of very sensitive testing we have now is difficult to do, because you can almost find 1 part per billion of almost anything, whether you use a product or not. So we say that there's a tolerance level. But in any way, the amount of antibiotic in the meat is negligible according to those withdrawal times. And then it's USDA's responsibility to set those same withdrawal times on any medication that is used, either bought over the counter or on the order of a prescription of a veterinarian. And those withdrawal times are set the same way, with a lot of research by the company that sells that product, that they will be less than the allowable limit of residue in that meat. And actually, by using no antibiotics or using the antibiotic with the proper withdrawal time, sometimes there's really no difference in the amount of residue that's in the meat.